Once again, welcome everybody to the first of 2022 Community Conversations. We have the pleasure today of hosting three incredible individuals who have come together to share their perspectives on the professionalization of interpreters and the networks that sustain them. Joining us is Lisa Morris, who currently is the Director of Cross-Cultural Initiatives for Disability and Community Services at the University of Massachusetts Tucson Medical School. She coordinates the delivery of medical interpreter training programs and workshops in collaboration with the Executive Office of Health and Human Services. Lisa also serves as adjunct faculty at both Rhode Island College and Cape Cod Community College, where she offers medical interpreter training certificate programs. Lisa has published and presented in the United States and in Canada on medical interpreting and healthcare access. Also joining us today is Andy Schreider. Andy leads the language access team at Cincinnati Children's Hospital Medical Center, helping them systematically turn language barriers into opportunities. He has worked as a Spanish interpreter since 2006, was certified by the Supreme Court of Ohio in 2013, and by the National Board of Certification for Medical Interpreters in 2015. He recently co-authored a paper published in Hospital Pediatrics on improving discharge instructions for hospitalized children with limited English proficiency. And last but far from least, joining us today is Jaime Fatás-Cabeza. Jaime has been the director of the undergraduate degree program in healthcare and legal translation and interpretation at the University of Arizona since 2006, where he has also developed medical Spanish courses for the biomedical schools and teaching hospitals. Jaime is a United States court-certified interpreter in English-Spanish, was formally accredited by the American Translators Association, Spanish-English, and as a certified healthcare interpreter Spanish professional by the Certification Commission for Healthcare Interpreters, CCHI. Jaime presently serves as CCHI Commissioner, has served on the Board of Directors of the National Council for Interpreting in Healthcare, where he is presently a member of its education and research, as well as trainers of trainers committees. A published translator and author, Jaime is active as medical, legal, and conference interpreter. So, with that, and without further ado, Lisa, please do take it away. Thank you.
Thank you, Zoe. Well, welcome everybody. I'm seeing all the hellos from afar, near and afar, but we're happy to have you all. So I'd like to start off by asking my colleagues here, how do we continue to nurture and create the professionalization of interpreter efforts and further the networks that generate sustainability and ongoing professional excellence? And I'll start by asking my colleague, Andy. What do you think about that?
Thanks. I think it's a tough question. If we look back historically, we've come a really long way as a profession. And I think that's been driven by individuals who viewed interpreting as a profession and wanted to dedicate their time and their energy to providing the best possible access for people with limited English proficiency or who are deaf or hard of hearing when they seek healthcare. And that drive from the individual is powerful, but it's limited because there are some interpreters I've met who don't view interpreting as a profession. They view it as a job, something they can do to get paid, and they'll find something else to do next year, in 5 years, or in 10 years. Yet, thinking about it from the patient and parent perspective, I don't want an interpreter who isn't willing to buy into this profession and follow these standards of practice and this code of ethics. And I'm not sure how we overcome that, how we make it a profession, even for people whose first instinct is to view this as a job. Jaime, do you have ideas?
Sure, I do, but I think that you just make a very interesting point, because I think there is a difference between a profession and an occupation. An occupation is something, is a job that you do to earn a living, right? A profession requires extensive training and special knowledge. It's usually this special knowledge and extensive training is usually best attained through an extensive approved academic curriculum. I'm minding the interpreter here, and practical experience that combine theory and practice, right? Ideally, both profession and occupation should be the same thing. But if we want to be treated as professionals, we need to be able to stand to professional standards. And right now, we are not meeting those professional requirements and standards. Not only because there are interpreters out there that, for very good reasons, they want to have a job and use some of the skills that they have, but because I don't think that as a profession, we are meeting the minimum requirements to be considered a profession nationally. And I have some, let's say, some things that I think we need to do in order to attain that professional status. But I'm going to stop here. I'll come back to that in a minute.
Jaime, that's really interesting that you say that, because that kind of leads me to think about the medical and nursing profession and their credentialing. Working in a medical school, I'm somewhat aware of that. And, and it's driven, I think, a lot by, well, their purpose is when they credential, it's based on the candidate's education, their training, their work experience and licensure. But at the same time, it's driven by the mission in my eyes and what I see. If you want to be a true member of the healthcare team, which I believe an interpreter, medical healthcare interpreter should be, consider if they want to be part of that team, then it's also driven by patient safety and the delivery of quality care. Yeah. So, chime in at that, because I don't, as you say, I don't know that we're moving toward that, but it's a slow moving target. And as Andy puts it, there are people who are in it just for the job.
So Andy, what was your take on what Lisa just said? And, I'm very interested in looking at us as a member of the clinical team and establishing parallelisms with other professionals that are members of that clinical team.
I like the vision. I think that a medical interpreter should be viewed as part of the care team. It's very challenging, though, to make that a reality for all situations. If we look at patients who come to my hospital and they say speak Spanish or Arabic or use American Sign Language, and we have staff interpreters, I know they're getting an amazing experience from those staff interpreters. And when we start looking at the vendors that we work with, doubts start to creep in. How often are these people working? How often are they being reviewed? How often do they get feedback? And when we start looking at remote interpreters, I have those same questions. And I can put things in my contracts. I can make some requirements for some things to happen. But at the same time, when we try to take this global view, we need to be very careful that we're including all those different people. The Spanish interpreter who's working 80 hours a week because they can, and the German interpreter who wishes they could work 5 hours a week and can't find even that. And viewing them all as equal members of the profession and equal members of the care team is an economic challenge, because that burden of professionalization is a lot higher when you can only work so few hours.
I want to jump in on that as well, because we do have organizations and networks trying to move the profession, such as CCHI and BCMI and other organizations throughout the country, the NCIHC, et cetera. One of the things that jumped to mind right away when you were speaking, Andy, is, we still aren't fully certifying for all languages. We have languages of lesser diffusion that, how do we even get there? I mean, it's a slow moving process. And then I've also heard the challenge, and Jaime, you can step in after me about this, about, you know, the pay scale isn't meeting the same needs when someone has to go through certification. And so what are we doing about that? There are so many pieces and variables of this story. Jaime?
Please, and we, you know, ours is a profession that is very diverse and with many challenges because, you know, there are many countries, many peoples, many ethnic groups, many races, many languages, many dialects, and we really have to accommodate everyone. But again, that's a challenge also for nurses, and that's also a challenge for technicians, and it's a challenge for doctors too. And then they are developing standards that we are not developing as a profession in order to be able to provide services in languages other than English or to act as dual roles. Again, if we want to be treated as professionals, we need to be able to stand to professional standards. And right now we are not meeting those professional standards. We have a number of job task analysis that demonstrate the knowledge in a vast, the knowledge that we need to possess in a vast number of highly technical and demanding areas. Is 40 hours enough for that? Is 60 hours enough for that? We need a comprehensive curriculum that is nationally accepted. And this is really a prerequisite for certification, licensure, and a specialization. That is also something that we should have in the profession. And of course, we need to be very mindful of languages of lesser diffusion and groups that come from non-literary, non-numerical traditions, from devastated regions, and provide the means to incorporate them also as professionals. For instance, CCHI, the Commission recently launched the E2E initiative addressing this direction. But we need legislation to regulate the provision of services. We have a lot of courses and buccaneers in the private sector that are exploiting interpreters or bilingual individuals in what really amounts to sweatshops where interpreters are working very long shifts back to back with no breaks and getting paid $13, $14 an hour. We need legislation to regulate the provision of services and its enforcement. We need to collect data. We lack comprehensive, reliable data in all major realms and domains. How many healthcare interpreters are there in the country? Do we have a figure? I mean, I know that perhaps if we tally those who have been certified by the Commission and by the board, we arrive to what, 8,500, 9,000? I suspect that that's just a small percentage of the people who are operating as, but we don't have those numbers. We need to forge alliances with the medical establishment about the value of our services. If we want their support, we need to raise our profile and meet educational and professional standards. We need to stand united. The profession is fragmented. We have 2 certification bodies. We have a number of professional organizations with very little coordination among them. And we need to stand fast and defend our core principles because there have been many things politically speaking, the dehumanization of immigrants, the dehumanization of the profession, technology, the corporativization of the provision of healthcare, the cost of healthcare, the millions of people that we still have that are uninsured. And so we really need to encourage our colleagues to pursue these high standards and remain engaged.
And you make it brings to mind the point that there are still many hospitals and healthcare organizations throughout the nation here in the US that are not functioning well with interpreter services, or even sometimes seeing the need to have interpreters as a part of their system. They're just covering it by whether it's over the phone or remote, video, but not really definitely applying that well, should I say.
Yeah. Yeah, automatic translation. It wasn't too long ago that I saw that the LA County hospitals, which is the most diverse linguistically and culturally speaking organization in the country, had Google Translate as the option for translation for their patients and visitors. That's a sorry state of affairs. An interesting topic that perhaps you want to discuss a little bit is the current state of technology and the use of technology also, and how it's affecting the profession. What do you think, Andy? You've been immersed in technology as your role as coordinator of translation services. You too, Lisa, we live in highly technological environments. What do you see there?
I can take that question on the translation front. There's a really fantastic paper that I think is going to help provide a roadmap for this that was published just days ago in the Journal of General Internal Medicine about bringing machine translation into healthcare. And they don't break any new ground, but they lay out a map saying, wait a second, if we're going to do research on this, we need to do it in a systematic way that leads to machine translation being more accepted in certain areas of healthcare where it can be done safely. Because up until now, the research that's been done has been, whoa, this is amazing, use it. Or, this is terrible, don't use it. And that doesn't help anybody. That doesn't help us because it's nuanced.
Yeah.
We know that, right?
If I may, another criteria that is many times overriding is, oh, this is very inexpensive, let's use it.
And that's tough. I mean, you need to view language access as part of the cost of doing business when you are providing healthcare. However, that's very tough because the cost can be very high. And what's legally required on the translation front is really small. You know, I think to provide great care, you have to translate a heck of a lot more than the law is requiring you to. And so in many cases, what health systems do, including ours, is turn to communicating verbally instead. You know, relying on that interpreter to accurately communicate that message and answer people's questions in the moment. However, that means, you know, back to your previous point of, we need to make sure these interpreters are well trained and are well skilled and are building and maintaining those skills over time. And that's a tough problem to solve. It's going to take the type of coordination you're describing, Jaime, to bring people together and move the profession to the point where something like licensing or legislation around that is even a possibility. And we have to keep our focus on the whole body of interpreting. Like you said, it's so easy for me to say, let's look at Spanish in-person interpreters and make them amazing. And while that has a real impact on patients and families, there are so many other interpreters that we also need to bring along for this ride.
Yep.
And there's still the recognition since I ever started in interpreting, and I'll just say it was in the 80s. That's about all I'll say. But I'm dating myself here. But that I've always heard it's an unpaid mandate, you know, and there's no money in the systems, and that's what we're suffering of in many ways when we're talking about this conversation, and it is about you know, the issues that still penetrate our society with bias and racism. I have to call it what it is. All of those issues where the need isn't, to some people, imperative, and they're not even looking at safety or quality care. Andy?
I just wanted to share one quick comment, and then
sure.
Then to you, Jaime, on the cost front. One of a senior member of our staff recently shared that from his perspective, a qualified, high quality interpreter is a low cost way to improve care and safety and expand the reach of excellent medical professionals. That when you don't have that access, not only do you not provide as good care, not only is it more dangerous, but it takes a heck of a lot of time, and you're paying people for that time. And so investing those resources in the interpreter actually is more efficient in the long run. Jaime?
I think that the no money is a fallacy is really a cultural, a financial construct with the wrong priorities. And as Andy said, look, quality care is based on a meaningful, productive, accurate relationship between providers and patients. And without an interpreter, that doesn't take place. So that's actually a premise. Okay, and it should be treated as such. The problem is that many, because of lack of enforcement, because of lack of standards, because of lack of commitment, they know, many providers, that they, or organizations, that they can get away with it, and they do. And that's something that we really shouldn't tolerate, not only as a profession, but as a society. I want to go back a little bit to the comment on technology, because I think that technology is really fantastic when it is used judiciously. New technologies are expanding reach and access and keeping many people from getting access as well, especially the elderly, the uneducated, the poor, because it's very expensive to have a network like the one that we are using today in our homes to have access to internet, and especially to rural and indigenous populations, or to non-literary, non-numerary societies, okay? And also, the two things. One is being pushed like crazy, especially during the pandemic, and now it's becoming the de facto default usage in many places, even when there are possibilities to use in-person interpreters, and it's pushing many professionals out of the profession, because you can rely on established networks, sweatshops, or things that are much less expensive than having a staff interpreter, but that we know that they don't provide the same level of quality as Andy was mentioning. So these are crucial issues that go right to the identity, the core principles, the accuracy, the beneficence, the respect for cultural diversity that make our profession.
And I want to go back, Andy, because I'm not sure if we were talking about that topic that Jaime just mentioned in terms of the quality of the delivery of interpretation when it comes from face-to-face, or your freelance interpreters that come from an agency, or from the remote video or over the phone interpretation. Could you speak to that again?
Sure. I think there's always going to be a difference between someone who works 100% of their time for a single institution and someone who works there only part-time or very infrequently. That's obviously going to happen. We have a campus called Liberty Campus. Please don't interpret it as Freedom Campus. It has nothing to do with freedom. Right? It's a simple example, but it makes a difference, and it causes some confusion around scheduling appointments. And that's always going to be there. But even if you assume that the quality of the interpreter on the other end of the phone is the same, there's a difference between being in the room and being on the phone. And while I think that's something that we need to work through, when I think about professionalization, the biggest issue that comes to mind for me is the individual interpreter investing time and energy in growing and developing their own skills and advocating for the profession as a whole. When you are a full-time employee of a medical center, you have time to do that. When you get paid by the minute for calls that you answer, anytime you spend learning or advocating feels like it's coming out of your own pocket, whereas time you could have spent working and earning more, or could have spent with your family. And it's that mindset that I'd want us to work towards changing first, so that we can build a unified profession that includes everyone. Those who work in a salaried way, those who work in an hourly way, those who work a lot, those who work not a lot, those who come from large communities, those who come from small communities. Bringing people together in that way, to your point from earlier, Jaime, is what it's going to take for us to turn this into a profession for everyone across the country.
And it's very interesting you state that, because professionalization, if you look at the meaning of it, it's being recognized for one's skills. So if you don't maintain or develop your skills further, you're not really moving in the spectrum or the continuum of professionalization. And that's what we're asking for, especially when you want to partner alongside a credentialed nurse, doctor, occupational therapist, or any of the above in the healthcare team that have a credential, a licensure to practice. And we are practicing, but we are practicing the practice of language to service the patient.
And if I may, Andy, I agree with what you said, but I think that we have to be very mindful that as long as conditions persist the way they are right now, there is going to be this huge divide between staff interpreters who work for mindful organizations that value them, and then contract interpreters, vendors, freelance interpreters who are really trying to make ends meet. Shifting that responsibility, the responsibility of changing the mindset in order to perform professionally, right? Raise yourself to a level where you really have what it takes in order to be a professional interpreter. Shifting that responsibility exclusively to the interpreter is not fair. This is something that has to come from above. It has to come from legislation. It has to come from the networks, from the administrations that provide those services. It has to come from managers. It has to come from the professional organizations. We have to make sure that living conditions for those interpreters that perform most of the interpretation work in this country, which are the vendors, are regulated and decent, that they get decent wages, that they are treated with respect. Because right now, you know, I have many students that are working as interpreters, not healthcare interpreters, utilities interpreters, 911 call interpreters, court interpreters, and they are getting $13 an hour. That amounts to $500 a week, $2,000 a month, $25,000 a year. And those are living wages for people who are doing that type of work. So we really need to look into those things, because otherwise it's a race to the bottom. And while I see many improvements in the profession in many areas, I also see that there are many things that are going down, and we are losing our grip as a profession unless we get moving on these things.
Yeah, well, there are two things in my mind. One of them is the fact that, as you're just pointing out, where do we see ourselves in 5 years if we continue on this journey in the direction that we're continuing? And I think that this is almost like a call to order, that we need to, one, gather more data, get the examples, and prove to the legislator and the lobbyist and whatever we need to, and the advocate organizations, to move this in the right direction. Because, and if we don't change it quickly, as you say, Jaime, we're moving in the downward spiral rapidly. There's all, you know, I know that everyone in all of the organizations to certify interpreters are working hard to get more languages on board, to do what we can. But as we all know, you know, it isn't happening as quickly. And I understand the reasons behind it, because it's a challenging situation. But there are also other challenges that we can start to address rapidly to stop any movement in the wrong direction.
So Andy, you have any thoughts that you want to share with this, or?
Yeah, I want to ask Lisa to clarify. What are those steps? Like, I am completely on board with the direction being legislation to support licensure, certification, or training, some sort of requirements for healthcare interpreters. Because without it, it's very challenging to get healthcare systems to make those changes on their own.
Right.
There are systems that will recognize that, and there are other systems that will, because of their population, because of the way they're viewing their finances or whatever, may say, this isn't an area we can invest in right now. If it's required, they don't have that choice. So I think that's a reasonable approach. And when you look at nursing and other allied health professions, legislation is the path that they have taken to ensuring that there are some minimum standards across the board at all facilities. So what are the first steps in that direction, Lisa?
Well, one of the things is right now, and I understand that many organizations aren't requiring certified interpreters yet. They say it's a best practice, and they will, you know, a certified interpreter is preferred and when you see a job description, but it's not required yet, because if they require it, we don't have enough certified interpreters to cover the demand at this point in time. Plus, for several languages, they can only get core or the.
However, there are some countries like Australia, Canada, and some countries in the European Union that they have developed national agencies that are supported by the governments in order to make sure that there is a standard across the board. Okay, so I think we should be moving in that direction. And of course, we need legislation for that. I think that healthcare translation and interpreting policy needs a new grand narrative and operational guidelines. It is about the economics, sure, like carefully looking into reliable assessment of needs and economic assumptions, which we are not doing. We are doing that at the local level with some organizations, about the demand and supply of goods and services, about public budgets, about fiscal consequences, fiscal breaks, for instance, for organizations that provide these services. But it's not only about the economics, it's a humanitarian and public health issue. So we really need to dig in and to start doing serious work about these issues at the level that we have right now. For instance, we have some powerful organizations. Actually, I think that your hospital is part of one, ACIN, okay? And then we have, the organizations in Massachusetts, we have organizations in California, providers of these services that are very powerful, that are really state-of-the-art operations, but we are not getting any data coming from there in order to document the need and all the advantages that you reap when you have an operation of those characteristics. Okay, I also think that there are also underlying problems that are very serious and that affect us as professionals and as members of our communities, that are the rising cost of healthcare, for instance, which is insane in this country if we compare that with other advanced democracies. For instance, issues that the lack of support for childcare, housing, education, these are all big ticket issues that are really hampering the financials in order to provide the type of services that we provide. The dehumanization of immigrants, which is something that is very, very worrisome, and that is an issue that is going to get much harder because of what is happening internationally, because of global warming and so on. The corporativization of healthcare, we are losing the human touch. We need more humans providing these type of services. Now you have to go to the portal, and then from the portal you have to talk to the insurance, and then you have to call the doctor's office, and then you have to talk to a scheduler, and then to a medical assistant, and then, gee, I want to talk to my doctor, and I want to have an interpreter that helps me to navigate all these issues. Labor issues, as we mentioned before, the digital divide. So we really need to get our professional organizations and all the interpreters, especially those interpreters that are well placed already in organizations like ours. Okay, I'm not an interpreter right now hired, but I've been a staff interpreter, but I am a public employee because this is a public university. We really have to be vocal and work proactively as activists to raise concern about these issues, get to our legislators, get to our professional organizations, get to our employers and tell them we need to do this. This is serious and is non-negotiable.
Well said. Definitely well said.
Can I just jump in for a moment?
Yes.
Guys, I don't want to stop the flow. I wish we had another 30 minutes to continue because it feels like you've just scratched the surface. But I do want to let you know that we've actually run over our 30 minutes by 3 minutes. And I would like to at least thank everybody who has been able to join us for today's roundtable. And I know that those of you who can stay on may stay on for a few more minutes if you're able to, but at least thank you for the time you've given us. Thank you to our 3 roundtablists. I'm coining a new term here, and our interpreter for being a part of this quite engaging exchange of ideas and thought-provoking concerns. So without further ado, thank you all for being here. And please do stay on if you have the time to do so. Thank you.
I've seen many things popping up in the chat about, the opportunity of full-time positions and not enough of them for those that are getting certified. That's a definite issue as well. There are many issues that we've raised today in this conversation. And, I would like for Andy to make a closing comment as well as Jaime, and I will wrap up with mine as well. So Andy.
I just want to say that I'm inspired that the group here today, both you, Lisa, and Jaime, as well as those joining us in the chat and watching, see the same challenges that we do and want to work together to address them. There's not a simple answer, and it's not an easy road forward. But by taking these things into consideration and changing what we can make progress in those directions. Buyers of language services can put requirements in contracts about training or certification or hours that are required. It's not going to affect everyone. It's a small step, but the more those things happen, the more we demonstrate that they're possible. So I think rather than us being overwhelmed by the size of the challenges, we have to take a step back and look and say, hey, what can I do? What can we do in our current roles to encourage this professionalization? Even as simple as sharing with another interpreter, your commitment to the code of ethics, the standards of practice, and bringing them to a webinar you want to attend. Those little things can build together and make a difference. Jaime?
Yeah, I agree with you, Andy, and thank you very much, Lisa. Thank you very much, Zoe. Thank you, Andy. It's really a shot in the arm to see that there are, kindred souls out there who really are doing great work and remain committed under difficult and pressing circumstances. Thank you also to CCHI for the opportunity, and thank you to Andy, the interpreter, the other Andy, for interpreting for us and bringing access to ASL community. Now, I just want to say something that has been always a source of inspiration for me. This is a quote from a distinguished author and lexicographer, Dr. Samuel Johnson, who himself, this is a towering figure even in our field too, because he developed a number of resources that were very useful for translators and interpreters for a long time. And he was a sufferer of Tourette's syndrome. And he said that the true measure of a man, I would say a person these days, right, is how she treats someone who can do her absolutely no good. Okay, so how do we treat people who can do us absolutely no good should be very much at the heart of who we are as professionals, as individuals, and as a nation. And that's something that in the last decades, we are losing sight of.
Thank you, Jaime. Thank you, Andy. Thank you, Andy, our interpreter. Zoe, for pulling us all together, as well as CCHI. And I would like to make a plea because many of you here in the chat and participating, we need more of you to advocate, to join organizations and networks, to create and maintain a constructive, supportive community of colleagues. That's what we all are. We're all noticing we have the same trend. Andy's from Ohio. I'm representing Massachusetts. Jaime's in Arizona. So it's a little bit of a spread. We haven't reached the West Coast, but we know they have their concerns as well. We're trying to bring them into this by continuing to share our ideas and giving active support. These meetings, this is only 30 minutes, but we need to really brainstorm more and really do something, not just share and brainstorm, but actually do something. So my plea is that people participate to do something to professionalize and create more language access. Thank you very much to all.
Thank you.